Radiotherapy can cause side effects in the area of your body that is being treated. You may also get some general side effects. Side effects usually begin 1 to 2 weeks after you start your radiotherapy for brain cancer. After treatment finishes, it may be a little bit of time before side effects start getting better. After this, most side effects usually slowly go away.
With radiotherapy, it's a focused treatment or a localised treatment, which means that we're directing at one part of the body, whereas other treatments that we give for tumours sometimes circulate around the body in the bloodstream and can have more side effects. So with radiotherapy, it's very focused, which allows us to minimise side effects to normal body tissue as much as possible.
Tiredness. This is a common side effect that may last for several months after treatment. Get plenty of rest. Do some gentle exercise, such as short walks, for about 30 minutes every day. Eat a healthy diet and drink plenty of fluids. And ask others to help with everyday jobs.
Everyone is different, and some people find that exercising does actually help improve their fatigue. But what I would say is listen to your body. If you need a nap in the middle of the day and you're feeling totally exhausted, take it. It's about getting through the treatment and not feeling completely exhausted on the other side. Eating well, trying to sleep well, and getting yourself out and about and doing a little bit of gentle exercise can often help. But if sleep is a real struggle, our neuro-oncology nurses do have some resources to help with managing sleep that they can offer to you if you need some help with them.
Radiotherapy to the brain can cause extreme tiredness 4 to 8 weeks after treatment. You may have very little energy, feel drowsy, and spend a lot of time sleeping. It gradually gets better over a few weeks. You may also get headaches during radiotherapy. If you experience headaches, then do tell your radiotherapy team, who can give you painkillers or steroids to help.
Headaches are very common, and headaches can really be sort of divided into two categories. Headaches that are quite a normal part of it and often are relatively short-lived. So say for example a bit of a headache in the afternoon that settles with something like paracetamol or ibuprofen, that is really quite normal. However, radiotherapy can cause a bit of irritation of the brain tissue and a bit of swelling. And if you're getting a headache that's becoming a bit unmanageable, it's really bothering you throughout the day and it's getting worse as you go through your radiotherapy, that's a sign to us that sometimes we need to be thinking about a course of steroid tablets to just try and help cushion you against some of that swelling radiotherapy is causing, and help improve those headaches for you. So that's one of the reasons we speak with you at least every week on radiotherapy, to make sure that there's nothing we need to do from a headaches perspective.
Skin reactions are a common side effect, and the skin in the area being treated may redden, darken, and feel sore or itchy. Wash your hair or scalp gently with lukewarm or cool water and use non-perfume shampoo or soap. Gently pat your hair or scalp dry with a soft towel. Don't rub it and avoid using a hairdryer. Follow the advice you receive from your radiotherapy team about using moisturizers. If you shave your head, use an electric razor instead of wet shaving, and wear a scarf or hat to protect your head from the sun or cold.
We do see a little bit of skin effects, and what I would generally explain to you is that usually around where your operation site has been, if you've had an operation, that area may get a little bit red and pink, like very mild sunburn, but it shouldn't be angry or sore. So if that's the case and you've got a surgical wound that's starting to leak fluid or starting to look a bit crusty, then it's something you want to tell us so we can have a look at it for you.
You will usually lose some hair in the area being treated, and sometimes on the opposite side of your head too, where the radiation beam exits. Your hair will usually start to grow back within 2 to 3 months of finishing treatment. Sometimes it grows back slightly thinner, or a slightly different colour than before.
would generally expect for there to be some hair loss around the site that we're treating. So around often where your scar has been, if you've had an operation, I would say to you that I think it's very likely you're going to gradually lose a bit of a patch of hair around that area of your scar, but it will grow back afterwards. But sometimes people find that the hair growth afterwards can be a little bit thinner, not quite as thick as it used to be. But it's very unusual, unless in certain circumstances we're treating the whole brain. It's very unusual for people to lose all their hair.
If you feel sick, your doctor can give you anti-sickness drugs. If you do not feel like eating, try replacing meals with nutritious, high-calorie drinks. Your doctor may be able to arrange these for you, or you can buy them from most chemists.
We do sometimes find some people are just a bit more sensitive to brain radiation and do get quite sick, and we tend to notice that a little bit more in our younger patients. So what we would say to you is that nausea of any description should trigger a chat with us to make sure that we can get that under control for you, because nausea is horrible, so we want to be able to control that. So if you're feeling sick or you're being sick, let us know and we'll start an anti-sickness medication to calm that down.
There are a number of side effects that may develop months or, more often, some years after treatment. This could cause changes to your memory, thinking and reasoning. This is called cognitive impairment. Occasionally, you may also experience a blocked ear. Changes in hormone levels can cause different symptoms, including changes to periods, changes to your sex drive, and severe tiredness. Your radiotherapy team will explain what to expect and give you advice on managing your side effects. Always tell them about your side effects. There are usually things we can do to help.
Ultimately, lots of people around to help you. No question is silly. We've heard it before. We'd rather know about a concern and nip it in the bud quickly, or any problem you've got, tell us. We'd rather get into it early and get it sorted before it becomes a major problem.
Please visit the Northern Radiotherapy Network website if you have any questions or queries.